I have doctors and nurses as friends. I'm always curious to know if you guys sleep enough, like enough rest. Next question. What's the best way to prepare for surgery, clerkship, and survive? Whew. Next question. So this is everything, but the truth is, what's up guys, my name is Jubril. I'm a first year plastic surgery resident and I'm a former CNA turned plastic surgeon in training. I grew up in Nigeria. I was born and raised in Nigeria actually. Went to undergrad over in Nigeria and I'm currently completing my plastic surgery residency in Chicago. I reached out to a bunch of my Instagram followers to ask me questions about everything. So pre-med, non-pre-med, medical school questions, and just general life questions. So I have a bunch of questions on my phone that I'm gonna answer. And this video is supposed to be casual to just let us connect and for me to be able to answer this question on a deeper level than I would on Instagram or DMs. Let's get into it. What does it take to succeed in residency? How can I build this mentality while I'm still in school? Well, I'm going to tell you, I'm a first year resident, so I'm still working on succeeding in residency. I have a lot to learn and I'm learning every day. I think one of the biggest things you can learn is being able to regulate emotionally. So on a day-to-day basis, there's going to be highs, there's going to be lows. There's going to be really busy days where you don't feel good, you don't feel like you know anything, and it is what it is. There's going to be days where you're crushing it and your seniors are telling you you're doing a good job and the attendants telling you you're doing a good job. You have to be able to find some level of stability, and the way to do that is to go into this mentally prepared as possible. So a lot of people do a lot of things. Mental health is pretty significant. A lot of people are in therapy. A lot of people take medications for any mental conditions they have. So a lot of people have depression. A lot of people have ADHD. It's very common in medicine. People just don't talk about it. A lot of people meditate a lot. A lot of people exercise outside of medicine. If you've followed me for a while, you know I don't play about the gym because that's just how I survive. That's my survival tactic. So a lot of people do different things just to be able to stay stable and to be able to go into this very mentally stable. I think that would be my biggest takeaway. While you're in medical school, you're gonna have the same problem, highs and lows. And the best way to do that is to preempt that life is gonna be like this for a long time, actually, for most of your career, even as an attendant. And just being able to emotionally regulate and stay stable is probably one of the best things you can do for yourself. And the way to practice that is to get in tune with yourself, identify who you are. Academic validation is good. Academic validation is real, but that's not the only thing that's gonna get you through surviving residency. Again, I'm a first year resident. I'm only 8-9 months into this, and that can change in 2 years from now, if you ask me. So keep following, maybe that's gonna change. Next question. Is it a good idea to apply to general surgery for residency and do fellowship in plastic surgery as an IMG? I think this is a really, really good idea. There's a lot of argument in plastic surgery right now, the general surgery fellowship being completely scrapped in a few years from now. So in case you guys didn't know, the path to plastic and reconstructive surgery has traditionally been, you do medical school, then you do 5 years of general surgery, and then apply into a 3-year fellowship, making a total of 8 years of training. And if you want to sub-specialize, you got to do like microsurgery or hand, which are 1-year fellowships after plastic surgery training. I'm not in that track. The new track is the integrated plastic and reconstructive surgery track, which is you go straight into plastic surgery directly from medical school, and it's a 6-year training program instead of 8. We do a lot of general surgery as well. So my first 2 years or so, I'm gonna be doing a lot of general surgery. Right now, I am doing general surgery. I'm in a surgical oncologist service as we speak. So general surgery is bread and butter to plastic surgery, and you need to understand how different pathologies work because plastic surgeons have to know a little bit about everything because we do reconstruction from head to toe, from pediatrics to adults. So you need to know a little bit about everything, how different pathologies are managed, so you can be able to help come in and reconstruct or close after other surgeons have done their procedure. So you need to know a little bit about everything. Is it a good idea? I think right now it's a really good idea. It's still a very, very popular and a very valid way of getting into plastic surgery. People do it a lot, and most of the older surgeons did that. It can be really tough if you don't enjoy the bread and butter of general surgery. I didn't find myself enjoying the actual surgery. I wanted to learn from general surgeons, but I didn't enjoy most of the surgery they did. Personally, I think they're cool. I think they're incredible. There's so many advancements, laparoscopic surgery, Da Vinci assisted robot surgeries, but it just didn't do it for me. I really found them really impressive, but they just weren't things I wanted to do. But if you do feel like you don't mind learning that stuff and you want to do that stuff for a while, then go into plastic surgery, I respect it. Also, being an IMG is really, really difficult to match into plastic surgery. That's just the truth. Plastic surgery tends to be one of the most competitive specialties every year. It's either number 1, number 2, or number 3 between dermatology and neurosurgery. So going the general surgery route and then going to plastic surgery is still pretty valid and is a great way to get where you want to get. The road to medicine looks different for everybody, and if it looks different for you, that's fine. That was a long-winded answer. Next question. I saw you at an IR conference slideshow last year. Past consideration. This is from Chin Inkem. Yeah, actually. So as a first year medical student, I had no idea what I wanted to do. I just liked everything, and I think that's probably why I fell into plastic surgery, because I liked everything. Plastic surgery offers me the opportunity to like treat across the age spectrum and across anatomy head to toe. I guess that makes it difficult sometimes, but that also makes it very, very exciting for me. So back then I was in between a lot of specialties. I wasn't sure what I wanted to do. I was in between radiology, I was interventional radiology, which also, if you think about it, that makes, interventional radiologists use the blood vessels of the body to like navigate the whole body from head to toe, and that was very fascinating to me. I just thought it was really cool to be able to help different people across the board. I considered diagnostic radiology, I considered family medicine. I enjoyed internal medicine a lot because they think slower and they process things a lot slower. It just wasn't for me. I just didn't find enough fulfillment in internal medicine. So I did consider a lot of things, and IR was up there. That was one of the ones I was going to consider very, very strongly. I just discovered plastic surgery as a third-year medical student, and I loved it so much that it became number 1 for me. I still think IR is cool. I get jealous of my IR co-residents when they talk about IR because I'm like, oh, that sounds so cool. But hey, it is what it is. Next question. If you were pre-med, how would you seek exposure at conferences and with your professors? I mean, the same way I did right now. It's just, the key is embarrassment is the price of entry. I'm gonna say this a million times. People, it's embarrassing. Being a medical student or being a resident sometimes is embarrassing, but that's the price of entry, especially if you don't have connections, especially if you don't know people, if you don't have the social capital that's required to navigate the medical space. It really is difficult, but you just have to put your big boy, big girl pants on and just get to work. For a lot of people, cold emailing professors, cold emailing researchers, cold emailing people you want to work with, people you want to coordinate with, is probably one of the best things you can do for yourself. At conferences, I found just going out and trying to talk to as many people as you can is the key. You need to be able to put together a 30-second, 40-second elevator speech about yourself that kind of summarizes who you are and gives the person you're talking to a good insight of who you are, what you're trying to achieve, and how they can help you. I would say don't go straight into, hey, I need this and I need that, because a lot of pre-meds and medical students make that mistake of just asking people directly what they need and not trying to provide value. At the end of the day, human interactions are transactional. A lot of people would offer to do research first before getting a letter of recommendation. Like, that's just how life works. So don't walk up to people and just be like, hey, would you write me a letter? Or, hey, they don't know you yet, but they want to know you. A lot of people want to help you in medicine. They just need time to do it and time to get to know you. So embarrassment is the price of entry. Reach out multiple times, follow up. Doctors are very busy. It's just the game. So just keep following up. They want to help you. They don't hate you. And it's not embarrassing. If they don't reply the first email, they'll reply one at some point. So walk up to people, try to talk to as many people as possible, navigate the spaces. It takes time, it's annoying sometimes, but you just do it and you just ride the flow, ride the flow. Is age a limiting factor when applying for residency since there are less experiences? I don't know if I fully understand that question, but age is never a limiting factor to residency. I have co-residents that are first year surgery residents that are like 5 years, 4 years younger than me. I have co-residents that are like 3, 4 years older than me. It just is what it is. There's advantages and disadvantages to different things. I think there's a lot of advantage into being a little bit older when you go into residency, because at that point you know who you are a lot more. You know what you want out of life, and you can navigate the spaces a little bit different. There's also a lot of advantage in being younger in residency. You can get through residency at a much younger age where you can focus on residency and you can focus on your career and be ready to be an attendant at a very young age, which is also a good thing. So there's pros and cons to the game. I think it depends on who you are and what you want out of life. There's residents across the spectrum at different ages, and that's just the game of residency. It's a mix of people, and that should not be a limiting factor for anything, actually. Next question. What's the best way to prepare for surgery clerkship and survive? Whew, that's a loaded question. Surgical residency, surgical clerkships can be difficult to navigate. That's just the truth. The environment is pretty fast-paced, and medical students tend to get either frustrated or annoyed that they're being ignored sometimes. It's not that they're being ignored, it's just that surgery is very fast-paced, and surgery, especially in the operating room, requires a lot of focus. You don't want to be distracted, so it can be really tough for especially younger attendants and residents to be able to take the kind of time you'd get from rotations like internal medicine or family medicine. Surgery requires just a lot of focus in the moment on the patient and just the patient alone. I would say there's two parts to getting ready for a surgical clerkship. There's the component of didactics, so the so-called pimping questions. That's something you do in your own time, and that's something you have to do. For a lot of people, there's always some textbook out there or a small PDF that you can read about some of the most common things that people want to ask you. And honestly, the most common things stay common. The most testable things stay testable for any specialty. So know a lot of things like general surgery. You're not going to be doing an appendicitis, and you're not going to be doing a cholecystectomy. There's just general questions that they ask during those cases that you just have to know off the top of your head. So study as much as you can for those most common questions that we would now call pimping questions. That's one component. So find the resources that can help you prepare for that and grind through. A lot of specialties have Anki decks out there. You know I love a good Anki deck. Just go through as many cards as you can on some of the most testable concepts and just get familiar with those concepts and why people would ask you those questions in different cases. That's one component. The other component is the clinical component. There's a lot of things that surgeons do on a daily basis. Your days can start as early as 4:30, 4 a.m. Some days, most times it's around 5. You need to be able to learn how to make a list. So figure out what goes into making a list in the morning, which means looking over the patient's vitals, eyes and nose, medications, fluids, things like that. You, as a medical student, while a lot of places might not expect you to do it right, I think it's a bonus point if you can get the list ready or work with the intern to get the list ready in the morning. You should be aware of all the supplies that you're going to need for dressing changes. So we do a lot of dressing changes in the morning. That's why we start off our days so early many times. There's a lot of patients that we need to see before we go into the operating room. So it really looks good when you know the dressings that this patient had yesterday or the dressings that they need today, and you have that stuff ready to go for rounds. I think it makes you look good. It makes you look like you know what you're doing. This stuff is really hard. As a medical student, I don't think I was like a perfect medical student and I had everything ready to go. Not always, but it takes time. But the faster you can get through that process, either you write things down during rounds of, okay, this is what we did today, this is what they're gonna need tomorrow, and you have those supplies ready to go. It makes your resident's life a lot easier because you're just going into the room with them, handing them things and getting ready for rounds. It makes rounds very efficient too. You just have to learn to be a good team member. Being a team member means doing whatever it takes for patient care for that day. It's tough, it is what it is. Another component is the operating room. You need to know how to scrub into the operating room. That also takes practice. You need to be able to emotionally regulate. There's a lot of tough personalities in the operating room, from the scrub tech to the circulating nurse. Everyone wants to take care of the patient a lot, and people come in with different levels of energy. And as a student, you're not always the priority, to be honest. The patient is the priority, and sometimes it's very annoying, but that's the game, and that's what's necessary for good patient care sometimes. I'm not saying people should disrespect you. I'm not saying people should be rude to you or invalidate you. That would not be okay. But a lot of times, all the team members are focused on the patient because that's the priority. And then they can teach you as much as they can. So understand this and ride with the flow. You need to be able to learn to scrub, and like I said, you need to be able to know your place when you go into the operating room, which means your positioning. These little things matter a lot. Don't try not to contaminate anything. Learn to keep your hands on the blue stuff alone, and be ready to help out in the operating room when the attendant asks you to. You need to introduce yourself to everybody every day, even if they know you. You need to remind them. Sometimes you walk into the operating room before the case with your mask on, with your scrub cap on. You write your name on the board. You can write the team's name on the board before they're ready. And that way everybody knows who you are and what your name is as soon as you put it on the board. It's really helpful to drop your gloves as early as you can. Don't expect the scrub tech to grab your gloves for you. Grab that stuff yourself. Ask permission to do so, then do it. Ask permission to help with putting the Foley in. Ask permission to help with putting SCDs on. Those are things that are going to come to you naturally, and you just learn to do those things. If you want me to go into all the specifics gradually, I can make a video for that and just go into all the specifics of getting into the operating room. And different cases look different. You're not going to be responsible ultimately for like positioning or for completely draping the patient, but those are things that you can help with that make you stand out and make you helpful to the team. And ultimately, you need to be personable. Like, I know you want to disappear and just not talk to anybody sometimes. It's tough, but it's okay. No one's gonna harm you or no one's gonna foul you. People want to get to know you. When there's downtime and there's good time to talk to people, ask about them, talk about yourself a little bit, and you'll be good. Next question. Why did you choose plastic surgery? Like I said earlier, plastic surgery encompasses head to toe reconstruction, and I really enjoyed that. I don't like being narrowed into one specialty or one area of the brain somewhere or one area of the arm. I liked, as a medical student, head to toe reconstruction. Now, is that realistic in 2026 when I'm making this video where you can do general reconstruction? Yes, it is, but a lot of times you can end up honing in into some more areas of plastic surgery. That was my appeal for plastic surgery. On my list on a plastic surgery service, I have a 6-month-old, I have an 89-year-old. So I have males, females, I have any other gender, they, them pronouns. So it's a good mix of seeing all the patients and different pathologies. It's also it's just fun for me. I enjoyed the intricacies of doing microsurgical reconstruction, which means taking skin, muscle from one place and helping other people. It's also a good collaborative environment because plastic surgeons are like the closers of the hospital. So if a neurosurgeon is doing a complex neurosurgical resection in the brain and they're like, wow, after we take out this tumor, I don't know if we're going to be able to close the hole. They'll call plastic surgery because plastic surgery has skills and secrets and techniques that, not secrets, but like techniques that help us close a lot of spaces, a lot of defects. So that's why we do a lot of rotations around the hospital, because we need to know different things about different people. Some of the most common surgical specialties that plastic surgeons would work with involve neurosurgery, orthopedic surgery, colorectal surgery. So we need to know a lot of things about different things to be able to come in and close, which I find very fascinating because it still gives you a huge breadth of knowledge. I also like that there's an entrepreneurial side to plastic and reconstructive surgery, whether it's creating biomedical devices or being an entrepreneur in some way. There's so many people in plastic surgery that are very entrepreneurial. I have my MBA. I like the idea of starting businesses. I like the idea of leadership. And I find that to be very helpful in plastic surgery. Plastic surgeons are often described as the surgeon's surgeon because people consult you because they don't know how to navigate a lot of soft tissue things and moving things around. So I really enjoyed a lot of it because it's a good mix, and I enjoyed that there's entrepreneurial components to plastic surgery. What med school did you attend, and what route did you do to achieve that acceptance? I attended the medical school in Chicago. A lot of you know, I'm just not going to tell you in this video. I attended a medical school in Chicago, and I didn't discover plastic surgery till my third year of medical school. I didn't even want to do surgery. But I found plastic surgery to be very fascinating, and it's a very competitive specialty, like I said earlier. So I knew I had to do a lot of research to get into plastic surgery, because at the time I was involved in research, but I just didn't have plastic surgery research because I didn't know I wanted to do plastic surgery. It's such a competitive specialty that it's really hard to come to the table. I wanted to apply to the match as strong as I could, and I wanted to do a lot more research. So I took a research year, and in that time I did a lot of research in plastic surgery. It honestly gave me so much exposure to the field of plastic surgery. I went to conferences, I published a lot of research, and I also started my MBA during that time. So that time was really helpful to get me started in navigating different spaces and to understand the big picture when it comes to plastic surgery. Then I studied hard for my USMLE as well, and was able to get into plastic surgery after that. Is 11 hours a day enough for study? It depends on what you're studying for. Typically, I feel like for most things, you don't need 11 hours of study daily. One, it's gonna burn you out. It's not realistic for the most part, especially as a medical student. I don't think you need 11 hours. On most days as a medical student, I think the max I would do would be 4 to 5 hours. There's like times maybe during exam season where there's just a lot of material to go through with your friends. You can hang out, go through questions together. That takes some time. But like on a day-to-day basis, I don't think you need to do 11 hours of studying, because that's recipe for burnout. It really is. During dedicated step 1, step 2, sure. You can get as high as 11 hours. There were times where I studied for step 2 for 6 weeks. And for those 6 weeks, I was doing anywhere from 90 to 120 questions every day and getting through those questions, reviewing those questions. So my day started as early as 8 a.m. and was ending at 6 p.m., 7 p.m. So basically 11 to 12 hours of studying every day for about 6 weeks. But that's for a short period of time. I don't think you need to do that longitudinally, because you're gonna burn out. It's inevitable. Even those 6 weeks, I think I burnt out because it's exhausting. But sometimes, hey, that's the game. It is what it is. But I don't think you need to do that every day as a pre-med or as a medical student. I think there's just going to be short periods of time where you need to lock in and do that. But for the most part, you don't need to do that every day. Next question. How tough is it for IMGs to match into surgery residency programs, especially for someone in Nigeria? It's pretty tough, like I said earlier. I covered this earlier. It is pretty tough. It's difficult. But I think there's multiple ways to go about this. And if you want me to make a video addressing just IMGs and going into surgery, I'm happy to do so. I can talk to a lot of my IMG friends to kind of come up with something. So if you do have specific IMG questions, drop those questions in the comment section, and follow me on Instagram and TikTok for the next time I make a video like this, so you can drop your own questions. But yeah, it's pretty difficult. I have doctors and nurses as friends. I'm always curious to know if you guys sleep enough, like enough rest. The truth is, the fields of nursing and medicine are pretty different. We all, go into the hospital every day, but we all have very, very different jobs. Even doctors, we all have very, very different jobs. My friends in psychiatry are not worried about getting enough sleep because they get enough sleep. A lot of my friends in dermatology get enough sleep. To be honest with you, I don't get enough sleep. Most people need sleep between 7 to 8 hours. There's times where I'm working a 28-hour shift where I barely sleep 1 hour during the shift. I do get to go home and sleep after, but it's not the same. On a day-to-day basis, I try to get 5-6 hours of sleep. Something about surgery is your circadian rhythm just starts to get used to this. It catches up with you at some points where you're like exhausted, but there's often times where you get 7 hours of sleep a night. And if you're in a good program like mine, like you get to rest a lot. You just have to be strategic about going to bed early and like optimizing for your sleep. So right now I have a lot of things in place that help me optimize for my sleep. I take melatonin at specific times at night. If I get home early, my lights dim out at certain times to just get me ready to go to bed. I tend to wind down at certain times of the day, get off my phone as much as possible. I still be scrolling TikTok though. It's not the same. A lot of nurses work 12-hour shifts for 3 days a week, or 4 if they have one job, which is stressful. It's a lot of work, but it's different. A lot of doctors in residency work anywhere above 70 hours a week, 80 hours a week. If you're in surgery, a lot more sometimes. So which can easily mean working 12 days in a row straight, or working 14 days in a row straight, or getting 1 day off in like 2 weeks. It's different. And you cannot even compare specialty to specialty because, like I said, I have a lot of friends in psychiatry, dermatology, internal medicine sometimes, where they work 50 hours a week, 40 hours a week, and occasionally, not always. There's a lot of nuance to these things, okay? So you cannot compare those things. You just have to talk to different people in different specialties. Like my neurosurgery colleagues are working significantly more than the plastic surgery seniors are. So it is what it is. Like, but it's the life we chose. It's what we have to do for the patient. It's what residency requires. Do I think it's a perfect system? I don't think so, to be honest with you. It's not a perfect system, but I hope you go to a program where the culture is encouraged for your wellness. And because this system was built by somebody that was addicted to drugs, in case you didn't know that, and did a lot of cocaine. So this system is also designed to make the most out of residents and help the hospital to make the most amount of capital from the job while paying the residents as little as possible. APPs are paid significantly a lot more with lesser experience. Now, I love APPs. They teach me everything as an intern. They teach me everything, but the truth is sometimes you've been doing this a lot longer, or at least the journey being a pre-med to going to medical school to get into residency can be a lot significantly longer, and you don't get the same amount of treatment, which is fine. Because they're fully established in their careers and you're not. But it is what it is, and we just survive. Next question. How do you stay confident in your skills while also admitting you're still learning? I think you're not always going to be confident in your skills because you are a learner. That's the point of being a learner, is to keep your head down and learn as much as you can. I'm not saying, disappear into the shadows and lose your confidence. I think you should be confident in the fact that you're a learner. You should accept within yourself and keep your ego down and say, I don't know enough yet, but I'll get there. And walk with your head up saying, yeah, I don't know what's going on sometimes, but I'm here to learn and I want to learn. And you're willing to do and try as many things as possible because ultimately you're a learner. I'm gonna stop the video here. I hope you enjoyed this one. Like, comment, subscribe if you can, and follow me on Instagram and TikTok for the next time I make a video like this. I'll catch you in the next one. Thank you for tuning in. If you made it to the end of the video, I want you to drop a comment for me. Say, I don't know, what can I say? If you made it to the end of the video, type the word match, M-A-T-C-H, because it's match week while recording this. All right, I'll catch you in the next one.